Hey, it's Diana and Susanna, your favorite global health scientists.
And you're listening to Global Caveat.
Today, we're going to talk about life-saving healthcare for women and children in Bangladesh.
Before we get started, we want to thank all our supporters who make Global Caveat possible. Your shares, subscriptions, and reviews mean so much to us, so if you're listening, take a few seconds to leave us a review. You can also become a contagion by signing up on our Patreon for as little as $1 a month.
Yes, please leave us reviews and become a Patreon if you can. But now let's dive right in. On today's episode, we'll be talking with Dr. Iftikher Mahmood, a pediatrician and founder of the Hope Foundation, a nonprofit organization serving women and children in Bangladesh.
Thank you so much. Let me make sure I'm saying this right, Dr. Iftikher Mahmood.
Yes.
Perfect. So, if you could give us just a short introduction and any contact information if people want to reach out to you.
So I'm Dr. Iftikher Mahmood. By profession, I'm a pediatrician. I practice in Miami, Florida, but originally I am from Cox's Bazar, Bangladesh. Cox's Bazar is the southern part of Bangladesh. It's a district. I medical school in Bangladesh, and I did my residency and fellowship training in the U.S. And in 1999, about 20 plus years ago, I started Hope Foundation. It was basically as a doctor, I wanted to give back where I came from. I saw some difficulties in healthcare, so I started the Hope Foundation. And since then, I've been working for the organization, setting it up. I started with a small one-room clinic, but over the time, it has grown to multiple hospitals and many clinics and training programs. And it's a good-sized organization. We have a website, www.hope.org.
Okay.
Awesome. Fantastic.
And let's talk about Hope Foundation a little bit. So what is it? What's the purpose of the foundation?
So the Hope Foundation, the full name is Hope Foundation for Women and Children of Bangladesh.
Okay.
So our focus is on women and children, well-being of the women and children, and for all women and children. But because it is in a underdeveloped country like Bangladesh, and we wanted to focus on the women and children who are facing difficulties accessing to healthcare, and that leads to different kind of health issues, even mortality. So we wanted to overall help them, support their care, regardless if they have a ability to afford that care. And so basically through our foundation, we set up hospitals and clinics. We train midwives, going to start training nurses, community nurses, paramedics. So basically not only set up clinics or hospitals, also give them like access to our healthcare professionals in the rural areas.
Okay.
Awesome.
Is there a reason you chose Bangladesh other than the fact that you're from there?
Well, yes, because setting up an organization and do the impactful work is a lot of challenge. It's easy.
Yeah.
So you do in a place that where you're familiar with the place, and you also know the people, you understand the community, and you understand the need. So it makes your work much more easier, and also you can set up exemplary work which other organizations or other people that want to do, they can do. Even though we set up the organization in Bangladesh, but we work with many or other organizations work in different countries and different areas. So we exchange ideas and views.
Okay.
We try to learn from each other.
Okay. I think it makes sense to set up an organization or an effort in a place that you do have a connection with.
Yeah.
Yes, absolutely.
So Hope Foundation, it does women and child health. And then is it headquartered in Bangladesh then?
So it is since I'm a US citizen, I live in the States and I'm the founder. So I started the organization actually in Florida.
Okay.
But our the work is in Bangladesh. We sometimes we participate in different healthcare and all this here locally, and we work with the different universities or their public health. Like sometimes I give talks and all this. but the work is in Bangladesh. The headquarters is in the U.S.
Okay.
Most of our staff, most of everything happening in Bangladesh.
Okay. And what are the, I guess, major health concerns that the foundation is trying to address?
So there is our core, the objective of our organization. As a founder, that's my mission and aim is to offer safe delivery of a pregnancy, right? So that is, I think, the core of our problems that I want to address. Because if we can give the safe pregnancy and safe delivery, then a mother that maternal mortality is very, very high in country like Bangladesh or in some of the African countries, right? Unacceptably high. And so try to focus on these. Make sure the mother is healthy at the end of the pregnancy and the baby is healthy at the end of pregnancy. So the family remains in a kind of not adversely affected, right? Say, for example, if the mother becomes sick or mother dies or the baby dies, it is a catastrophic event for the family, no matter if they're poor or rich. But if that part is, done well, then you can avoid a lot of problems. So we focus on that. So to do that, we do a lot of things. How do we do that? Because you have to set infrastructure, you have to set up transportation, safe transportation, like when you are you are in a labor and you need to go to a hospital. If you don't have an ambulance or if you don't have support to go to a hospital, that time can be catastrophic. So you have to set that up, as well as you have to well trained people to work in your system who can actually give the help, because right. And also we work on mental health of the family and of the mother, because physical health is very connected. So there are so many things, but at the core is basically give them a safe delivery. That's our ultimate objective.
Okay. And so I find that very interesting, and I think when you say self-delivery, I think, like you mentioned, some of the examples you gave, there are so many different aspects to safe delivery, from like prenatal care all the way through the pregnancy, and then even when the delivery time comes, and all the way up to after birth as well. So in a lot of ways, you're doing this community work, and are there how do you navigate, because you're a male physician and you're working primarily with women, and so how do you navigate the difference in just gender and power dynamics?
Okay, so even though male physician, because if you look at the women's doctors like gynecologists and obstetrics, they are mostly male actually. So I think in medicine, gender is not such a big factor, and at least in my experience. But however, in the working in the rural area, you can understand the community, because culture adjustment is a very important factor. So for all the midwives that we train, 100% of them are women, no male midwife, and most of our people that getting trained to our foundation, and in the future also will be overwhelmingly women. Right? So I am sort of an administrator. I don't actually do physical. I don't have to do physically deliver the baby. People who are delivering the baby are like all of them women. In our system, midwife system, but we have male physician as well, who does help with the baby, but very small number.
Okay.
But in fact, my experience, I tell you, more than the gender, the community or the segment of the community we're trying to serve, I think it's more important for them is the person who is providing the care. Does he or she understand that community? Does he or she can connect to the community? Because most cases I have seen, they really don't mind, because my mother is from that community, my wife is that from my sister. I've never heard any complaint about a male doctor, female doctor, gender issue, but I heard complaint about not being given proper attention or care in the competence. These things I have heard, but I think it probably helps, provided be in the same gender, of course. From female, does it make sense? And we do overwhelming number of our stuff.
Sure.
Yeah. Okay.
And when you talk to women and families regarding their care and then the delivery, how are men, like their partners or their husbands, do you include them in those conversations as well?
Yeah. So it is. I've been working over these things for a long time. So
Mm-hmm.
I obviously had to have a lot of ideas how to make that accepted in the community, how to work with the community. So I coined a phrase for maternal care. Safe maternal care is called golden chain. So golden chain is like a chain,
Mm-hmm.
like so. Chain is like all the links are there. No links are broken, right?
Mm-hmm.
Because I say that you can ensure safe pregnancy if you maintain the unbroken chain. Right? Unbroken chain means in that chain, not only the patient, not only the midwife, not only the nurse, but the family as well, but the society as well. So her family members, her parents, or her parents-in-law, or her husband, her brothers, everybody will be involved in her care. So there will be no break in the essential link of that chain. So yes. So we want to involve, and we do that because in the rural areas where we work, we frequently visit their families. We do community fair, community gathering, community. We have mothers club where we do like in different areas we do meetings where a lot of their family members come and join in addition to the pregnant woman. So getting involving their family and the community is a part of our golden chain.
Awesome. Great. I have a question. So a lot of what you've been discussing and talking about is primarily around delivery, and I understand that that's the main thing that the Hope Foundation is focused on. But there frequently, like, women's health is conflated with the whole concept of like maternal health and child health and delivery and pregnancy and everything. But are you doing other work to work on women's health and prioritizing other things besides just maternal needs and child needs? Like, what else? Or what are the other things that the foundation is doing? Yeah.
Yes. So we do maternal health, child health. We set up infrastructure. As I said, we have two hospitals. We are under construction a third hospital. We have a training facility. We have rural medical centers, birth centers. So in addition to this, we also work on we are specialized in caring for obstetric fistula. Obstetric fistula is that also related to maternal health, where the mother develops a kind of hole in her private area where the birth canal and where the baby the labor is obstructed for a long time, and the baby dies, and baby has to be taken out by C-section or like manually remove it. And during the process, there's a lot of injury happens in that area, and that leads to incontinence of urine and sometimes urine and stool. So obstetric fistula very common in rural, like underdeveloped country. In Bangladesh, we are kind of pioneer in that work. We have experienced surgeon who we have sent them for higher training in different fistula center in the world, and also we invite fistula surgeons to come and work in our center and train our surgeons. So we have a strong, I think one of the strongest fistula care team in Bangladesh.
Oh,
We have,
awesome.
and that is we are building this new hospital. It's called Hope Maternity and Fistula Center. So this will be maternity care as well as fistula. So we do that. We also, as I said, we developed a mental health program for women and community in general. We are heavily involved in the refugee care. And there is a Bangladesh. There is, that probably know that there is a Rohingya refugee crisis from Myanmar. A million people that fled Myanmar and came and took shelter in that area. So we have set up a field hospital there. We have set up many sexual and reproductive health center, which is again taking care of gender-based violence, mental health counseling, trauma counseling, and all this. We do that. We also have a program for telemedicine where the doctors from the U.S. and other countries join for consultation our telemedicine program. Also, we have cleft surgery program where we take medical mission from overseas, and we have burn surgery program. We take medical mission from surgical mission from US. There is an organization called Research International in San Francisco. They go there every year, and actually next month they have a trip planning together. So these are surgery that we do there to the mission. It is a very top class care, which is not available in Bangladesh. So this is also we get patients from and many different countries, many parts of Bangladesh, who otherwise would not get that care.
Okay. And are all these types of care available for? Because you mentioned the Rohingya refugees as well. So does your foundation distinguish between like a Bangladesh citizen versus a Rohingya refugee?
No, we don't. We don't because they are all patients. Like whoever we are able to give care, like we do, and we are running 10 centers inside the camp.
Wow.
Including a field hospital. We set up a large field hospital there, as well as 10 centers inside the camp. So patient is a patient. Whoever can help.
Sure. And I see you have a question, Dana.
Yeah. So I was just wondering, you listed so many different things that you're doing, which is fantastic that you're offering so many different services. I was wondering a little bit about how working with and offering the mental health services is accepted in the community and in Bangladesh, and how everyone works. Like, are they accepting of going to get mental health services, or is there any stigma around that, or how is that working in that area?
Yeah. So mental health care is fairly new kind of care in our area because in Bangladesh there are so many other diseases and issues there that the priority. There are other disease conditions that are priority. So mental health sometimes it is not something that being addressed. But as I am a US trained physician and I am actually guiding this organization, so I try to bring in the care that which actually easily complement with what we are doing.
Yeah.
Because we do fistula, a lot of fistula patients are depressed
Okay.
because of their isolation and social stigma and all this. A lot of women has postpartum depression, right? So a smaller mental health team can do a big job.
Yeah.
So that's why recently we got put together a mental health program. And we have a partner in Poland who, Kulzik Foundation, they have helped us with some funding to set up this program. So we started, and we are trying to hope to make it bigger. And we also involved a lot of U.S. Large number of actually Bangladeshi American doctors here are in psychiatry, in the field of psychiatry. So we involve them as well.
That's great.
And, they frequently visit Bangladesh, go to our clinic, and do the guidance, do like the mentoring our mental health team. So we use a lot of free resources that they are like, because I find that there are many doctors, Bangladeshi doctors here in the US and other countries. They want to give back to Bangladesh, as well as many non-Bangladeshi doctors here. They want to volunteer. So we are kind of expert in asking help, seeking support from different people. They want to give support. That's where we get a lot of free but very valuable care for our programs.
So I actually have a question about that, because as a founder of now this pretty large organization, you're working with a lot of different people and partners internationally. And I'm sure you have certain things that you expect from your partners, and then certain things that you're looking for in terms of what they can provide and what your partnership looks like. And as someone who's leading this organization, you really don't want to partner with someone that could either provide like unethical care for some reason, or not be good with the patients, or maybe lie and say that they have experience with working with the Bangladesh community, but they actually don't. So have you experienced that, number one? And number two, how do you address that and prevent that from happening?
Right. So, because I'm in the field for a long time, right? I've been in the field as a medical doctor, as well as a global development organization, running a global. So I've been in this for a long time, and being in for a long time, I learned a lot. How to identify the right kind of help, how to not waste my time or my resources, how not to give my time and attention to wrong person, right? So that is first of all, it's an experience that like myself I developed, and almost 100% of the all the professionals that work through Hope Foundation, giving the free service and volunteering, all of them goes through me personally because I like to make sure that a doctor is being guided by a doctor because if I send a doctor who is a very experienced doctor, a professor, say plastic surgery, burn professor, if I connect that person to a junior level doctor in Bangladesh, they will not connect. They will not know, they will not be able to connect with each other. So I definitely make sure that I screen everybody that wants to go to Bangladesh, a nurse or a midwife or a doctor, whoever professional, I screen them. I don't mind spending my time because I get this service for free. If I spend 1 hour screening and if I get their service for 1 month, can you see the difference? What I gain? So I don't mind. So with any given time, if I find a doctor or nurse who want to go and contact our organization, I personally interview them. I look at their CV. And when I look at their CV, when I talk to them, I know what they can do and what they cannot. And if I feel that they're not able to do things ahead of time, we don't take them. We don't take them. We don't take just anybody go and just want to, I can do whatever you want, or I can just, I can carry the bags and all this. We don't. We want highly skilled professionals.
Sure.
Serving. So that's how we.
That's good.
To give you an example, last year in 2019, I personally interviewed and hosted volunteers for different length of time, starting from 3 days to 6 months. I personally interviewed and hosted over 100 international volunteer physicians, nurses, and midwives. So, and right now, I interview almost every week.
Wow.
That's
right. Every week I interview, and it also helped me to build. You see, one of the other thing I do is I built a network of people who help our organization. And believe me, these doctors, nurses, and midwives, they are very, very resourceful, right? So when I build a relationship with them, partnership with them, they go serve here in Bangladesh and come back. And many of them, after coming back, they raise a lot of money for us, or they connect me to other professionals, their friends. It's the growth is much better for the organization if I give some time, I give some effort, and the value is value a lot, and I also can work with them and guide them. What is it I need or what our organization need? And so they if I psychiatrist, I want certain kind of care. If like neonatologist, I can certain kind of care. So make sure that they go there and they are able to do the job in a limited period of time well, and when they come back, they feel they have done something.
Sure.
Yeah. So from what I just heard, you said that you have people that go and volunteer and work in the field anywhere from 3 days to 6 months.
Yes.
Is that really short amount of time to have someone there for 3 days, or what is able to be done during that kind of time? Because things that are like shorter sound very like, how much can you get done in that short of amount of time?
Okay. So, for example, somebody go for 3 days who is experienced in giving a lot of skill-based training.
Okay.
Right? Let's say cardiopulmonary resuscitation, neonatal resuscitation, training, skill development. You don't need it's like a crash course, right?
Yeah.
Sometimes we go to a 3 days training or 5 days training that change our training level, right?
Yeah.
So,
that makes sense.
That's what some people. There are people that too experienced, right? And they cannot afford months after months going from the US, probably from a university who has a busy job. They, I'm gonna go for a week or 3 days. I'm gonna give this and training, and I'm gonna do follow up later on, or somebody else will follow up on my training. And we always do the follow up training.
Okay.
Make sense?
Amazing. Yeah. And then also, what percentage of the staffing and the resources, like human resources that you have in Bangladesh, are people that live there permanently versus how many are being sent in your professional network of people from the US or from other countries that aren't Bangladesh based?
Yeah. So our like staff wise,
Mm-hmm.
so we have about 550 staff, for example, 500 around 550 staff, and we have in a given time 5 to 10 international volunteers.
Okay. Awesome.
So it's like 2% or 3%.
Yeah.
Okay.
Yeah. And this process that you just, talked about, like interviewing and all this stuff, was it always like this, or how did you start? Because when you start, it's so small and you only have like your own immediate network. So how did you go about growing to where you are now?
Well, I grow very slowly. I go
Mhm.
slowly but steady, because I started a very small clinic part time, like twice a week. A doctor, part-time doctor, come and write some prescriptions and like that.
Mhm.
From that position to open a small hospital, it took me 5 years.
Okay.
Wow.
Right after it took me 10 years to start. 12 years from the time I started the foundation. So 12 years it took me to start my training program.
Okay.
So I can tell you, so 99, actually, you can say 2000 I started, because 99 December I started. So
Okay.
2005 I opened a small hospital.
Mm.
And 2000 actually 12 I started doing surgery. So, like in the hospital at that time, we didn't have any surgical facility.
Yeah.
Okay.
So 2013 we started the midwifery training program. So it slowly and
Yeah.
it's like a baby that grow.
Yeah.
It grow with me. Right? Yeah.
Yeah.
But it's
So,
a very solid organization now.
yeah.
Because when I started, it's only 2 people. Now
Wow.
530 or 50 people,
Yeah.
right? So, I mean, it took me 20 years,
Yeah.
but I tell you that in last few years, it grew really fast.
Mm.
Now, because we have a critical volume that we have to achieve, volume of work, now we have quite a bit of credibility.
Sure.
So a lot of there are many good partners we have,
Mhm.
and network is better, and also we have a lot of experience.
Yeah.
Yeah.
And I imagine in any organization, resources is always something that you want. So primarily funding, right? You want funding to keep doing the work that you're doing. But were there any like political or cultural barriers, anything systemic within working in Bangladesh um, that were kind of setbacks or just took longer to get to a certain goal?
Uh, Bangladesh is a very good country to work. Actually,
Mhm.
like just because there is quite a bit of need. And Bangladesh, if you look at Bangladesh, we have actually Bangladesh was founded in 1971. We used to be part of a different country, then we became an independent country.
Mhm.
1971. So it is only 49 years, right? 9 years, and we have grown pretty good. And I would say from very difficult situation to now, we have a very good GDP. We have very good leadership,
Mhm.
very good leadership, and we have a good history of development work. Like some organization like BRAC, Grameen Bank, and all these is like development work stuff. And also, Bangladesh is a very women-friendly country because of our garments industry is pretty much run by like millions of women that work there. Our prime minister, past two prime ministers were women. So we are. So these are the things that helped a lot for
Yeah.
my work, for our organization work. And you ask about barriers and setbacks. I would avoid that, discussing that, because I feel that it is a really nice place to work.
Yeah.
Nice place to. There are issues with, sometimes you'll see the, statistics, corruption and inequality, bureaucracy and all this there. I mean, it is everywhere.
Yeah.
Every country. So I
True.
don't want to go there because I
Yeah.
see the opportunity is so good and I have been so successful.
Yeah.
And I think that it is a good feeling that I work in Bangladesh.
Sure.
Yeah.
Absolutely. I do want to touch base back on the Rohingya refugees that you're working with now. So is that more within the last few years that the foundation has been working with the refugees?
Okay, so we have been working with refugees for many years because the Rohingya issue has been going on for over 30 years, back and forth, people push back and all this.
Sure.
So there were like Rohingya people in that area for many years. So we have consulted them. We have given services, some training, some of those, that people that were in the camp. So we did cleft surgery, fistula surgery, and all this smaller scale because those are a small number of Rohingya refugees were there. They were under UN charter. So UN organization were managing them. Because we are local, we had some resources. We used to work with them and help them a little bit. Mainly work with the regular Bangladeshi community.
Sure.
But from August 2017, when the mass exodus happened, and we got like massive involvement there because we are right there. So we are one of the first organizations to be at the camp to give, service right away because at that time, like 100% of the people were traumatized, like somehow physically or mentally. So everybody needed help. Nobody was in good health. So we are right moment for us to were involved because all the big organization was flying in from other countries or from other parts of the country, but we are right there. So we got massive involvement. We continued that involvement till today.
Okay.
As a foundation who is at the forefront providing services for the Rohingya people, what would you say are your current biggest needs to provide them with even better services?
So, the influx happened in August 2017. Now we are here in February 2020, right? So over 2 years, almost 2.5 years, right? So it's a long time, but for them, I think there's a longer time waiting ahead for them because we don't see any right now. We don't see any sign of repatriation because we are hoping that they will be repatriated quickly to their land and they can restart their life. But so far, it became like a chronic issue now. The emergency is over, and now it became a chronic issue. So it looks like we are not sure how long they're going to be. It's a large number of people.
Yeah.
So a lot of chronic health problems are there. Problems with education, employment, their rehabilitation, all these are there. But as we are focused, as a foundation, we are focused in health mostly,
Right.
like acute care, chronic care. So we have hospital, we have health centers. So now we are trying to integrate like mental health there because as they're staying there long in like without job, without real hope.
Yeah.
So still, the mental health needed. So we are, and also we are bringing in care like dental medicine. We are trying to do a program to set up program for chronic diseases. So these are the things we are doing as an organization. Also, in the future, if the government permits, we'll probably do some educational program there, like training, healthcare training for the Rohingya women. But it all depends on if we are allowed to do that.
Yeah.
But whatever in healthcare wise, we are allowed to do all those things that I mentioned.
Okay.
That's good.
So a lot of everything that you've been talking about is obviously in Bangladesh, but a lot of people have not been there and don't know what that looks like, right? Or they don't know exactly what it is like to experience those health needs. So can you talk a little bit about how it's similar or different and how the health system kind of works there versus a health system like the US?
Oh, the health system is a huge difference.
Yeah.
See, in the US, I've been practicing medicine since '92, so that makes it almost 30 years, right? So you see that in the US, and any other developed country, what you have is strong, very strong public health, right? Public health means sanitation, immunization, awareness, and also, necessary support. You have, clean toilet, clean water, things like that. See, that makes a big difference, So, so in country like Bangladesh, though many of those things that we enjoy here or we have here, we don't even know, right? That is important. They don't have it.
Yeah.
So they're always vulnerable to infection and all kind of chronic diseases.
Sure.
Yeah.
And also, like even food, like here you have an FDA, you have an EPA, you have some sort of guidelines and screening and food and things like that. In some many underdeveloped country, you don't have the food guidelines. You can just make anything for people. So that is the major part I see. The difference, right? Other than that, if you go to Bangladesh, there are some nice looking hospitals. They have very well trained physicians as well. So a small number of people can get, if they want, top quality care in Bangladesh in some places. But in general, regular people don't have the sort of public health infrastructure.
Yeah.
So that put them at a higher risk, which you and I don't see it in.
Yeah.
Make sense?
Yeah. So just a small thing, when you mentioned, like public health efforts like hygiene and sanitation, so I imagine in the clinics that you're setting up and the hospitals you're setting up, you have some pretty strict guidelines on keeping the hospitals clean, especially for delivery rooms, because that can get messy really fast.
Yeah. Absolutely we do, because as I say, with a lot of us from US trained, so we try to bring in some of the learned things that we learned here to Bangladesh that actually distinguishes us from many other hospitals. And also, as I mentioned, we discussed about so many volunteers going from the US and the UK and Australia, Western countries. When they go there, they actually contribute in many ways. Direct care, training, and all this. But they also kind of try to modify the working environment. And since we have a constant stream of international professionals, they remain always. There is some kind of changes happening all the time without being noticed. Sometimes we don't notice it. Sometimes local people don't, but it's happening, right? Because these doctors are going there, nurses are going there. They are not gonna they undo whatever they have learned or been practicing in the US for such a long time. So they will go there, say, okay, this is different. Let's change it, make it more. So we do pretty good. Our infection control is very good. Infection rate is very low. Our hospitals are very clean, and we try to strictly follow a higher standard of care. To your previous question about the health structure and all this, generally infrastructure-wise, our hospitals are, less equipped or say less, stringent in the structurally. But at Hope Farm Hospital, I can tell you that all our clinics, we take it very seriously in terms of infection control, cleanliness, and service.
Great.
Yeah.
I don't have any further questions. Do you, Diana?
Is there a reason, this is like going back pretty far, is there a reason that women in more rural settings are more prone to have fistula? Because you said that it's common. Like, is there a reason for that?
Of course, there is a reason for that. Because, I can talk about Bangladesh, but same thing happens in all underdeveloped country where the fistula is common. So fistula is basically when the labor the time is prolonged and due to obstruction, because there are some risk factors that no matter how long you wait, no matter how much you do, you will not be able to take the baby out normal vaginal birth. Okay, because of different reasons, like one being small pelvis, one being baby too big, one being position is wrong. There are a lot of those things. You can wait days after days after days, wait for the normal birth, it's not going to happen. So baby, and because these women, number one, they are in the rural areas. There is no hospital there that you can consult a doctor. And two is that there are not many trained healthcare personnel in the rural areas. Three is that many times they are far from the hospitals and clinics and all this. Fourth, sometimes they cannot afford it, even though they are nearby. Maybe they cannot afford to pay for the hospital, or they cannot afford to pay for the ambulance. Fourth, they are probably don't know, sort of uninformed. Fifth, sixth, say they are being cared by a local traditional birth attendant who will tell that otherwise. That don't worry, it's gonna happen. I'm doing this and that and that. Local, traditional medicine. They will try traditional maneuver. They try. Baby dies. When the baby dies, so baby is pressure in the uterus, lower part cervix. So due to the pressure, the actually blood supply got obstructed, blocked, and the part become necrosed. It become necrosed forever.
Okay.
So you lose that tissue, right?
Okay.
You lose the tissue become necrosed. So the baby, they take the baby out. If the mother is, sometimes they will take the baby out by hand, or like last minute they say, okay, let's go to the hospital. No matter what, they will sell some of their assets or something, like whatever they have, or borrow money from loan sharks. They'll go to the hospital. They'll see section or whatever. But then it develops fistula. Once the fistula develops, so this, as I said, it happens in the rural areas, and we mainly work in the rural areas, by the way. But what happened after fistula? Because when this happen, they start leaking the urine, and sometimes urine in the stool. That they get pretty much separated from the husband. They don't have any marital life anymore. So they lose their baby, they lose their husband, and pretty soon they start developing a smell that with them all the time. Right? So they are not actually welcome in their any family.
Sure.
Right? They may be there, but they are they have no life basically.
Yeah.
So that is the problem with fistula. But fistula in Bangladesh, there are still a lot of fistula, and one of our goal is to we call it no fistula left behind. That's our slogan.
Okay.
So we'll do everything possible to at least one thing, which is eradicate fistula from Bangladesh.
Sure.
Okay. Cool. Okay.
So if there are trained clinicians or interested people who want to work with you out there, where should they go to apply, or just get some interest?
They always can, for any question, any queries, volunteering, giving donation, giving advice, consulting, or giving anything they want to help us, or giving some ideas. They can go to www.hopeforbangladesh.org.
Okay.
HOPEFOR Bangladesh.org. And there is an email contact. So you can email or call.
Yeah. Okay. Great.
We respond quickly.
You all do actually. This was a very quick setup. Are there any remaining thoughts that you have that we haven't addressed that you would like to say?
I think you have asked a lot of good questions, and I'm happy that you have invited me to talk to you. And Hope Foundation and myself as a founder, very passionate about maternal health, because we believe that, and I learned it coming to US, by the way, that women's health is a very important issue, because when that part is like half of our society. If they are in good health, the whole society will be in good health. That's I learned.
Yeah.
And in Bangladesh, as you know, many women don't work; they're housewives, which is fine.
Yeah.
But because they don't work, they're housewives, and sometimes their man or the society is not enlightened. So sometimes they neglect their health, right? Neglect their health, and which actually very bad for the society. And investment is not that much.
Yeah.
It's just the giving the care, the basic care. It's not But with that small investment, you can return it enormous.
Sure.
That's what I say, because and that's why I'm trying to prove actually that, but doing the work and giving the attention, the basic attention, you can prevent fistula. That family is intact. You can prevent a maternal death. I mean, for example, in Bangladesh, maternal death is 176 over 100,000 pregnancies, right? I mean, it's very, very in a country like Norway, Sweden, right? It's 1 or 2.
Yeah.
In the US, a little bit higher than Norway, Sweden, but still much, much lower.
Yeah.
Because you see, it's a very high maternal mortality. If the mother dies, how that family can be productive? I mean, how that family can survive, because the kids, the husband, everybody, right? So I understand that deep, and I want to promote that. And my goal is not only to help the community that I'm serving right now, but I want to, at some point, if I get a chance, I want to take this message to other people as well. There are many other countries, I want to go to those kind of forums and tell why it is so important, why it is so important for their country, for my country, where I come from, a country like Bangladesh. It's so important that if we want to grow, if we want to develop, we cannot forget our mothers, other women of the community. If we do that, we'll develop no matter what, because they will be healthy, they will help men to work better. That's my message.
That's a great way to end it.
Yeah.
And that's the episode. Thank you to Dr. Mahmood for talking with us. As a reminder, you can reach him at www.hopeforbangladesh.org.
And the transcript and resources for this episode are up on the website.
As a reminder, if you have any questions, you can always reach us at globalcaveat@gmail.com or on Instagram and Twitter at globalcaveat.
And again, thank you to all of you, our listeners and supporters, for helping this podcast run. And a special thanks to Cordell Glass Hot Cocoa for producing our music. Thanks for listening. 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 Thanks.